on to education on immunotherapy related events, how do you provide culturally competent education to all your patients regarding the immunotherapy related adverse events?
Lisa, it's a $1 million question, and it is. I have a lot of experience in cultural competency and providing culturally competent care to the patients. Place that I work, it is like a multicultural mecca. We have people from all around the world living in this area, and they are bringing their own cultural beliefs to the table. And we always know that we as oncology nurses, we say patients, whatever patients say, it is correct. So if they are asking us, if they are complaining to us, if they think that we are not providing the right care, we always say patients are right, and then we have to convince them with more rational and explain everything to them. So bringing a patient that is having their own cultural beliefs and educating and providing the right treatment and care may be challenging, or I can say could be challenging. So one thing that is really important is to promote multiculturalism, because we see that we are working in a multicultural society. Bringing cultural competent courses to nursing curriculum at the very beginning will make a huge difference. Making sure that in our work environment, we have diversity. We have diversity of nursing leaders, nursing staff. Like if I have a patient that is not speaking, for example, Urdu and speaking only Punjabi, it is great to make sure that we are hiring people that are Punjabi speaking, or people that are coming from like Hispanic background. We have to make sure that we have people that can speak Spanish to them. And we do have a diverse group of nurses that are working. And one of the opportunities to promote a culturally competent care to our patients, I think is especially these patients that are going through these immune checkpoint inhibitors. We know the mechanism of action is very different. We know these patients may have diarrhea, which is not a diarrhea that is caused by chemotherapy. So the way we are educating our patients with our diverse population, different cultural background, is challenging. So we have to make sure that we are approaching the care of this population in a very culturally humble manner. When I say culturally humble manner, I can give you some examples about that, because the ideal education and introduction will definitely establish a respectful and culturally informed relationship. And if you can do that at the very beginning, when you see your patients, if I'm going to the waiting area to bring in the patient for the first time to my immunotherapy clinic to educate them about the treatment they are going to start, if I have an Oriental patient, or I have so many Chinese patients that they don't like even to shake hands with you. Like, I'm just not talking about the pandemic or COVID time, but in general, when you bring the patients or when you go and introduce yourself to the patients, not everybody likes to have an eye contact with you. Not everybody likes to have to shake hands with you. Not everybody likes to have a hug at all. But there are people like my patients, like my Italian patients. They love to be hugged all the time. Well, again, forget about the COVID-19 and pandemic era, because we will pass these days. We have to be very more cautious about how we are treating our patients, how we are establishing at the very first saying hello or introducing yourself, how are we establishing that culturally humble manner with our patients? Just knowing very simple thing like, how would you like to be called? Can I call your first name? Or would you like to be called by your surname? So these are very simple, but at the very beginning, the patients will know that I am in good hands. And the reason I say that, because I hear that from the patients. They say that from the very beginning, we felt that you care. It is not just a patient. You are there for us. If you know that you can hold your patient hands, you will do that. So, and never underestimate the power of social history. Know who is your patient, where do they live, how do they get transported to the cancer center, and what are their religious practices. There are so many little things that all together will make that patient the person who is sitting in front of you from a different cultural background, different religious practices, and so on. So it is important to make sure that we understand that and we follow their, as much as possible, we follow their cultural competent or cultural beliefs before providing the education or any assessment. Even before doing the assessment, not everybody likes to be exposed. Not everybody wants a male doctor to examine them. Not everybody wants a male nurse even to ask them to put the gown on because we want to do a thorough assessment in your body. So these are things that we have to consider before getting the patients more and start that relationship. So again, going back to establishing a trusted relationship with your patients, if they feel like you understand them, you do care about them, you respect them the way they are, and respect their thoughts and beliefs and practices, I can assure you they will call you if they do have any questions or if they face any side effects, because they know that you are there for them. They know that you are caring about them and they trusted you. So they will call you, and that will definitely minimize the emergency room visits, and because they call you at the right time. And we know that majority of these immune-related adverse events and toxicities could be managed if they have been reported in a very early stage.
Thank you, Massey. That was really great. And I agree with you. Not every patient's the same, with the different background, cultural background, different beliefs, different race. We have to treat them how they like to be treated, how they like to be called, how to understand their culture, their beliefs, in order to provide better care for them.